New information this morning on what has been a somewhat confusing topic, hormone replacement therapy for women going through menopause. It had been thought that HRT could increase the risk of breast cancer, among other things, but new data being released now shows that is not the case. Here to explain is NBC News medical contributor Dr. Narula. Dr. Narula, good morning.
Good morning.
This is something that doctors have known. HRT is fine unless you're in this other risk group, but this is a lot of people are still not sure if it's safe. So this study kind of backs that up, that it is.
Well, I think there's a lot of fear, there's a lot of confusion, and this is a result of the original study that came out almost 20 years ago. And at that time, it was widely publicized that there was a lot of risk. A lot of women stopped taking hormone replacement therapy. But here we are now, 20 years later, the data has been reanalyzed, and doctors have really been practicing a more modern approach that is different from the results from 20 years ago, which is to say there is a group of women who could potentially benefit from hormone replacement therapy. Who are those women? They're women who are under 60, who are within 10 years of menopause, and who are low risk. For these women, the benefits of taking HRT may outweigh the risks. Now, there are risks. We know they're low, but they do include things like stroke and blood clots, and in some cases, breast cancer for certain estrogen, progestin type therapies. But again, you're weighing that benefit risk ratio and making an individualized decision. And that is really what this is about, which is a conversation with your doctor for shared decisions.
So the idea, though, is to take HRT before all those menopause symptoms hit, before the night sweats and all the rest of it.
Well, the idea is to take it if you have vasomotor symptoms, right? So that is the indication for taking
What's
HRT.
Vasomotor symptoms?
So it is the night sweats, right?
Okay.
It is like the trouble feeling hot flashes. It's those types of symptoms that HRT really does seem to help. Not as much the other symptoms like sleep disturbance and other things. There are other non-hormonal medications which are options as well, but HRT is really the most effective for those vasomotor type symptoms.
So if you're feeling that before menopause, talk to your doctor. Maybe HRT is right for you.
Any time, whether it's perimenopause or postmenopause, if you're in that window of time before the age of 60 or earlier, but the once you get later, then the risk does seem to increase.
Okay.
Thank you, Dr.
Thank you.
Hey, thanks for watching. Don't miss the Today Show every weekday at 11 a.m. Eastern, 8 Pacific on our streaming channel, Today All Day. To watch, head to today.com/allday or click the link right here.